Welcome back to Leading Experts, everybody. I'm your host, Grayson Foster. If you're just tuning into the show, my guest today is Dr. Elon Chang. She is a general and cosmetic dentist. She's also a member of the Academy of General Dentistry, the American Academy of Cosmetic Dentistry, and the Doctors of Conscious Sedation. And she's also certified in dentistry for diabetics, and we've been discussing many aspects of certainly cosmetic and general dentistry. Dr. Chang, let's talk about dental implants, because they certainly seem to be at the forefront of dentistry. How important is it to replace missing teeth?
I use an analogy, for instance, your teeth kind of balancing each other out.
Okay.
And just like you have books on the shelves, and if you pull one out and all the books kind of start falling apart on you, that's the same principle. So if you have one tooth extracted, for instance, then your teeth will kind of misalign. They're going to rotate forward and backwards, and there'll be all alignment, within a few years.
Right. And doesn't that obviously is going to affect your jaw and the shape of your face?
Right. It causes what's called shrinkage of your jawbone. Eventually, those areas will shrink away. Then you won't have any support. You're making any kind of replacement of that area very, very difficult.
Now, years ago, people just used to kind of do dentures, but now dental implants are certainly fantastic.
Right.
How have you seen dental implants change some of your patients' lives?
First of all, I think they can function so much better. We have a lot of patients, they had dentures or partials before. What happens because of jawbone shrinkage and things like that, and then eventually it's very hard for them to wear these kind of appliances. And also that when you have implants, you can not only you can function so well and also preserve your jawbone also, and so it's making the function so much better, and also that just make you look so much better. You feel so much better about yourself also.
Certainly, it's a quality of life issue as well.
Right, definitely.
You get more vitamins out of your food.
Sure.
And, when someone is going through the dental implant process, how long does that sort of take from beginning to end?
It varies. I would say between 6 months to a year, depending how much bone you have.
Right. Okay. I know we're going to take a look at some pictures. The first picture we're going to take a look at is a single tooth replacement.
Right.
Okay.
This is a front tooth. This patient has lost a tooth in the front. So what we did was we put an implant in that area, let it integrate for about 3 to 6 months, and then you place a permanent crown on that tooth.
And obviously there's a temporary tooth that they're wearing.
Right. There's a temporary stage that you have to go through between 3 to 6 months. You wear something temporary for a little while. Okay.
Our next photograph is, this person has several missing teeth.
Right. This is basically I believe it's 3 missing teeth over here. So what you do is you have the implants put in those areas here, like the previous example. You let it integrate for a little while, and then you put what we call all ceramic bridges in that area, so they look just like your natural teeth. They function very well also.
Yeah. The last one is also a denture-supported implant.
Right, correct. This one here, this patient has lost their teeth for a long period of time, so their dentures are flopping around. There's no retention. You can't really wear the denture. So, so what we did was we did 3 or 4 implants in that area here, and the denture is attached to the implant, so they stay in really, really well for him. He can function really well.
Doing implants, is it very expensive?
Implants is expensive initially, but they have done a lot of research after like 6 to 7 years. It'll be a lot cheaper than replacing, using bridges and other modalities, and then it's so much less expensive because it lasts you for a longer period of time. Right.
Is it something you have to be completely out for, unconscious?
During the implant surgery itself, sometimes some people would like to do it, but you don't really need to. Just like you having a tooth extracted is no different from that, or having a procedure done is no different from that either. Okay.
I know certainly you have excellent credentials and certainly extensive training, not only in implant dentistry, but certainly cosmetic dentistry. Why do you think cosmetic dentistry has really become more and more popular?
I think the media coverage, for one thing. People is aware of what options available, and also people are more conscious about how they look. They know all these things available, so they're looking for the best for themselves.
What kinds of cosmetic procedures are you offering your patients?
We have all kinds, from a simple, a single white, fillings, and we have crowns, and we have veneers. We have even full porcelain crowns for your back teeth. They look absolutely beautiful. We used to have we call porcelain fused metal crowns. They have like a little dark margin that they just have very, very, very unsightly. Now they have all porcelain crown. They just look very beautiful.
Wonderful. I know in your practice you focus truly on treating the whole family. You say that your youngest patient's 3 and your oldest is in the 90s.
In the 90s, right,
Yeah.
right. Yeah, we have a variety of various ranges of patients, yeah.
Now the patients that is in his or her 90s, do they still have their teeth or?
You'd be amazed, majority of them still do. You know, if you maintain your gums and make sure they're healthy, your bone levels there, you can pretty much keep all your teeth for a lifetime, really.
Is age 3 when you should first start seeing a dentist? Your parents should
Between
bring you?
3 to 4, depending how mature they are, depending whether they have any cavities, how well they take care of their teeth.
Do you think that there's a lot of people out there that maybe want a smile makeover but think to themselves, I just can't afford that?
Well, you know, we have a lot of financial avenues now
Options.
you can use, and there we definitely take credit cards, obviously, and other things. We have a lot of financial institute we work with, and you can have payment up to like 5 years, and it's very affordable at this point.
So when someone comes to see you for a cosmetic consultation, is that initial consultation free or?
Most of the time it is.
Yeah.
Just to meet and find out, you know, what's involved, and meet the staff and things, and feel comfortable with the office also.
And how long does that process take? Let's say they want a new smile makeover. Is it months and months?
It
or?
varies. If it's just, for instance, like cavities in the front, or you have a little misalignment of your teeth spaces, things like that, we can do it within, I would say, a couple weeks or so. Okay. Other people with worn teeth and they're more complicated, sometimes it take up to 3 to 6 months, just depending on their situation.
Great. Dr. Chang, I'm going to take another break. Stay with us, everybody. Leading Experts will continue right after this.